Good afternoon, everyone, and welcome to the Hunt Institute Early Efforts webinar, Rural Childcare in America, Innovative Ideas. I am Holly Hickson. I'm the Deputy Director of Early Learning at the Hunt Institute. For the benefit of anyone who may be joining us for the first time today, the Hunt Institute is the creation of our founder and namesake, four-term North Carolina Governor James Hunt. We serve as an educational policy support to governors, state legislators, and other high-level state elected leaders. We cover the full spectrum of education policy from early childhood, prenatal through age 8, and through the workforce. In our Early Efforts series, we focus on the early childhood portion of this continuum and are excited to welcome a terrific panel today for an important conversation about rural childcare in America, focusing on quality, access, affordability, and recruitment and retention of early educators. We are excited today to be joined by Annalise Romer, Senior Director for Partnerships and Family Engagement at Save the Children Action Network, Ann Brandt, Executive Director of Lincoln Littles from Lancaster County, Nebraska, and Monica Wells, Family and Community Program Administrator from Buffett Early Childhood Institute at the University of Nebraska. Before we begin, I want to go over a few quick housekeeping items. Later in the hour, we will share some of your questions with the panel. If you would like to contribute a question, please use the Q&A function in your Zoom toolbar. Please know that today's session is closed caption, and you can also access those settings at the bottom of your screen. And finally, you'll be able to find the recording of today's webinar on our YouTube channel within the next few days. Just go to YouTube and search for the Hunt Institute. So our first question today is for Annalise. Can you tell us more about your role at the Save the Children Action Network and how it aligns with the Early Learning Nation Collective? Annalise, you're on mute. I'm sorry.
There we go. Holly, thank you. First of all, a big thanks to the Hunt Institute for the opportunity to be here today to speak about the work of Save the Children, and specifically the advocacy arm of Save the Children, which is Save the Children Action Network, known as SCAN. I'm excited to share more about our efforts to support early childhood programs and also to learn from the other panelists. So to your question, Holly, I'm the Senior Director for Partnerships and Family Engagement at Save the Children Action Network. And in this role, I work very closely with our team of Family Engagement Senior Associates. Let me tell you a little bit more about our Family Engagement Program. Our senior associates work in 7 states, largely in rural counties and parishes, to connect with parents and caregivers and to partner with them to advocate for greater public investment in early childhood programs. We know that moms, dads, aunts, uncles, and other caregivers understand firsthand the value of early childhood programs and quality early childhood programs. So we believe that they're some of the best advocates for children in their lives and in their communities, and for the programs that support those children. Those are the advocates at the heart of SCAN's Family Engagement Program. However, we work with many constituencies, early educators, K through 12 teachers, high school students, college students, really to mobilize, advocate, and build bipartisan support to make sure that every child has a strong start in life. I also work with external partners, and that's where the Early Learning Nation Collective comes in that you referenced, Holly. The ELN Collective is a newly formed national network that's working to ensure all children through age 8 have equitable access to the care and education they need to thrive. The collective brings together expertise to support local decision-making, to find solutions for children and families. At SCAN, we're working within the collective to support and increase the number of local leaders who are able to advocate for and advance early childhood opportunities in rural communities. And we're doing that largely through our family engagement program. You can learn more about SCAN's programming and some links that you'll get as a follow-up that I believe the Hunt Institute will send out to all of you who are listening in today.
We definitely will. So after our webinar today, if you registered for the webinar, we will be sending you a key takeaways document, and we will make sure that we are able to include information from all three of our uh, uh, resource experts and their organizations. Um, Annalise, I just want to ask you a quick follow-up question.
Mhm.
What are some of the 7 states that you're currently working in?
Oh, absolutely. Washington State, New Mexico, Tennessee, South Carolina, West Virginia, Kentucky, and Louisiana.
Thank you so much, Annalise. So our next question is going to be from Ann Brandt with Lincoln Littles. Could you please tell us more about how Lincoln Littles was formed and how it has grown? And could you also expand on uh, within the past year or so, you've expanded into workforce education initiatives. So if you could talk a little more about that as well.
Okay, well, thank you so much for inviting me to participate today. I'm excited to tell you a little bit more about Lincoln Littles. Uh, our organization was formed actually just 4.5 years ago in response to a larger community initiative called Prosper Lincoln. So we're in the city, the capital city of Nebraska, Lincoln, Nebraska, within Lancaster County. So in 2014, the Nebraska Public Policy Center and the Lincoln Community Foundation administered a survey to over 2,000 people to determine what areas could be focused on to help more people prosper. So not surprisingly for probably people on the call, early childhood education was one of those um, areas of focus, as well as affordable housing, workforce development. But our strand was early childhood education. So we were tasked with waking up every day and working on systems work in regard to improving outcomes for children in Lincoln. But prior to our organization starting in 2020, we did have Michelle Suarez, who was just one person hired to lay the groundwork, raise awareness, develop a network of advocates in our city called the Lincoln Early Childhood Network. Basically, she was tasked with getting people to work in the same direction. Because that doesn't always happen in communities. And so then in 2020, our office, Lincoln Littles, was established, and there were just two of us, myself and my colleague, Suzanne Schneider. And then recently, we are now an office of 5, 4.5 years later, with 3 full-time employees, 2 part-time employees, an intern, and a communications team that helps us tell our story, which is absolutely vital in this work. And I also just wanted to mention as well that we became a Communities for Kids community through support through Nebraska Children and Families.
Congratulations.
Well, we already were one, and we are a pillar community now, but they were instrumental in helping us, organize and support through funding and technical support. And so that was through Nebraska Children and Families Foundation. And their aim is that, ensuring communities can grow through strong early childhood presence in the community. So in Lincoln, our goal is for all children to have access to high quality early care and education. And our strategic plan, much like probably others who are in this field, is around affordability, because we know it's just too expensive. Quality, we don't want children just going anywhere. We want them having quality experiences. We also need to connect with our community to help them understand why this matters, as well as the businesses, especially now that people are having trouble hiring, working with businesses, trying to get further business engagement to help them understand their employees and how they can recruit and retain. And then obviously all of this rolls up to policy, because without really stronger, more transformative policy change to change systems, it's really difficult to get long-lasting sustainable change. So last year, we're lucky in our community, and I think my main theme here on what I'm talking about is just how many interested parties we have in our community, between those that I've already mentioned, but we also have the backing of our community foundation, which has just been really amazing. And we have a board of advisors, and we had a volunteer who said, I'll head this up. And why don't we talk about workforce? Because really all of these things that we're trying to do as the workforce is leaving in droves, we must figure out how we can recruit and retain workforce. So we did some preliminary research, did a survey, realized that really what we needed to do was hire a workforce program manager to address the workforce crisis in the early childhood industry. So we did that in, I guess it would have been March of 2022. Is that right?
Yes.
And from there, or it may have been 23. I can't remember, but anyway, I think it was 23. So from there, we designed a workforce program, and we've offered that in the last year 6 different times. And it's called the Child Care Teacher Foundation Orientation. We've taken 74 individuals through the program in the last year. Many child directors used our course as a way to incentivize hiring of staff, because due to a Nebraska Department of Labor grant, we were able to incentivize by offering retention bonuses, as well as tuition assistance for childcare needs for those who needed it that wanted to work in childcare. So the class itself covers basics such as 2 early learning guidelines, first aid and CPR, health and safety, among some other things within those courses. But those participants can accumulate up to 24 hours of training credits upon completion. And in addition, our intention is to support childcare employees for a minimum of 10 months through attention to their wellness needs, because we know that you can't take care of people unless you're taking care of yourself. So within those wellness cohorts, we also are providing opportunity for ongoing dialogue regarding childcare employment, childcare instruction, behavior management. It's just what we noticed is there were people really craving being part of something where they could interact with other humans, right? After COVID, I mean, people just wanted to be a part of something. And so we're really creating relationships through this work. And additionally, I will say that most recently, we were happy to partner with the American Job Center to launch a 6-week internship program for those who are interested in childcare employment. And this partnership offers payment to participants at no cost to childcare providers, as well as support for participants with childcare, housing, transportation during that internship period. And based on survey results that we've done with childcare providers, we know that directors and staff responded in the fall of 2023, indicating that affording living expenses was an issue affecting staff retention and burnout. So we're pleased to embark on this new partnership, and we see it as a positive regarding sustainable support for early education employees. And then one other thing, Holly, I'm sorry, I'm going to just say one other thing. And then we just wanted to mention our success that we've had in engaging immigrant and refugee women who are interested in working with children and becoming entrepreneurs. So one example was a woman in our first cohort who did not feel comfortable or confident to take formal higher education courses until she attended our program. And through our program, she did get more comfortable. She had more confidence. And upon completion of our program, she enrolled in our local community college in an early childhood program. So that's exciting. And then most recently in our last cohort, we had another woman who was a teacher in Mexico. But when she came to the United States, some of those requirements did not transfer to be a teacher in our public school system. And so her dream is to start her own business. So she and her daughters attended our last cohort, and they are now, they're going to do family home childcare, but they're working with a realtor right now thinking, maybe we'll do a center. So you can read more about her. Her name's Melba, and at our website, lincolnlittles.org, under the tab Stories, we have a story from our communications team to tell a little bit more about her story.
Wonderful. I'm always amazed at the innovative ideas that come out of when a community pulls together and invests. And that gives me the perfect segue into Monica Wells. Monica, your role at Buffett Early Childhood Institute with the University of Nebraska is in program development with a focus on the Douglas and Sarpy County Superintendent's Project. Could you talk about this, as it's referred to, the SOUPS plan, and how you engage families and community?
Absolutely. First of all, I want to say I am very excited to be here today. So thank you for the invitation and to be sitting alongside these wonderful ladies, Ann and Annalise. Annalise, I can't wait for you to add one more state. That needs to be Nebraska. I'm going to
Yeah,
have
you know I'm pushing for that one.
I will add, we do work in more than 7 states with various constituent groups. So Monica, I'll share that out with you.
All right.
Yes.
I see me in your, I see us in your future, and
Mhm.
go Huskers. It's nice to be on the screen with a fellow Husker here in Nebraska. So as Holly said, I do work here at the Buffett Early Childhood Institute. Very proud of the work that we do here. The superintendent's plan is the area that I work in the most. About 10 years ago, legislation passed a bill developing a learning community here in Omaha for Douglas and Sarpy County. And those there was 4 things they wanted to focus on within that learning community, and that was attendance, family engagement, literacy, and early childhood. Through early childhood, thus was born the superintendent's plan that was led at the time by the infamous Sam Meisel, who is near and dear to my heart. But through the superintendent's plan, we are able to work with 11 districts here in Douglas and Sarpy County. We focus on leadership, excellence, instructional excellence, and family and community engagement partnership within all of our schools and beyond. And so I am the administrator for family and community engagement. If you ever want to sit and talk to somebody about family and community engagement, I am always open, as I believe that family and community is the bridge to academic success. And so when we focus on that, all else will fall in line. I also am very proud to serve on the advisory board for the We Care for Kids campaign. Look that up. And we are spreading awareness about the crisis that we have in childcare. And so anything family, community, anything early childhood, anything about our babies, I'm here. In fact, one of our leading guideline for Buffett is to make Nebraska the best place to be a baby. And
It
so
sure is.
and beyond. And so just blessed to work with people who are all over the globe doing the same thing. So I'm very humbled to be here today.
Thank you, Monica.
Did I answer
Monica, could you maybe just expand a little bit? I know the program um, works out of the school districts, but one of the things that is unique about the program is the focus on connecting childcare to public schools
hmm
through family child cares and centers. And I know there is a grant that you have with Lakeshore
hmm
providing materials to the to childcare centers in Douglas and Sarpy County. Could you expand a little on that for us?
Sure, I can. So through working in our schools, we're able to focus on building up our leaders within the school. So our principals, we have wonderful principals within our both Douglas and Sarpy County, and then we have our specialists here who I label the Avengers, who work amongst the teachers in the buildings and work on those instructional practices. Um, and then within family and community, we work with kind of spearheading home visitors and
Mhm.
family facilitators within those schools. There's a new position that was developed in one of our largest districts here in Nebraska. And that position is called a community facilitator position. And that's the position that Holly's talking about. This position specifically builds a bridge between early care providers and our schools. We want those babies to be able to touch that environment before that they are even enrolled. They need to have their feet on that foundation and be able to help our families be prepared and answer those questions to be prepared for those transitions. It also helps with getting to some of those needs first. So if there's any special education needs that we're seeing. How can we help connect those parents to the school first to get some of the assistance that they need? One of the things that sticks out in my head this year is we worked with some of our care providers in our South Omaha area, and a theme kept coming. And they said we need some support with our students with autism. And
Mhm.
so our community facilitator partnered with Monroe Meyer. They created a 3-part series where we had parents, teachers, paras, administrators, everybody coming together to learn how to support all of these students. So that position is very, very, I believe it was the missing piece to our puzzle, Holly. But through
Wonderful.
there, we're also able to provide some supports, as she talked about, with Lakeshore, a
Mhm.
lot of partnerships with our lending library
Mhm.
that our care providers love. One of our community facilitators created a bodega, and so we know at the end of the year, all of our teachers are like, yeah, I thought I needed that stuff, but I really don't need it anymore.
Mhm.
Compiling those things, getting them ready, and being able to provide those for our care providers has been awesome so that they can come and have some of those tools that they need. But not only are we assisting them and giving them some professional learning, helping them with what they need, we're learning from them as well. Our child care providers have a wealth of knowledge that we can
Mhm.
learn, help support our students to help um, create that collaboration between the schools and the care providers. So we have monthly book reads that I love.
Yep.
Um, and some of our 0 to 5 babies come in from home visitation to enjoy that. But recently this year, it was wonderful seeing our care provider vans pull up full
Yay.
of babies coming out of there to come enjoy, and they loved it. I heard a student last time I was there that said, "This is the best day ever." So being able to have their feet on that soil before they
Mhm.
turn 3,
Amazing.
4, 5,
Yes.
yeah, it's been awesome. So hope I
Wonderful.
answered. Mhm.
So just a reminder to those of you listening in, we are going to do one more round of questions, but then we would love to ask some of your questions. So if you can use the Q&A function on your Zoom toolbar, if you have any questions, put those in there, and then we can get to those right after we go through this next round. Annalise, taking the round robin back to you. What are some grassroots ideas you have either heard suggested or seen in action that are making an impact on the childcare deserts and rural communities that you serve? If you can't think of a specific example, what would you see as a solution?
Thank you, Holly. Well, at Save the Children Action Network, we are building and sustaining a grassroots movement for early childhood. So I see this in action day in and day out, and I see it resulting in wins for children and families in rural settings and in urban areas. In fact, last year, SCAN's advocacy contributed to securing more than $900 million across 8 states to help young children thrive. That's the work of our advocates of a grassroots movement of volunteers in communities across those states. So I would love to share just some of the components of this organizing that I consider foundational, that I think can be replicated and built upon in different settings. And number one is a diversity of voices and experiences for early childhood. We need parents, we need grandparents, we need early educators, we need home visitors, K through 12 educators coming together to bring their professional and their lived experience and expertise to organizing for young kids. And two, Anne referenced interested parties, and I would call that coalitions. Creating coalitions or becoming part of rich coalitions that already exist with shared interests in early childhood is key. Again, this includes early educators, K through 12 educators, foundations, researchers in the business community. We just cannot win for kids alone, and we must have those partnerships and coalitions to win. Three, we need to build, and we are building legislative champions for early childhood. So at SCAN, we do this from the get-go. We work with advocates in communities to engage candidates for office while they're on the campaign trail. educators, home visitors, parents are out there asking candidates while they're on the campaign trail to speak to early learning and to early childhood, and are bringing early childhood into focus early on in the conversation. Once those folks are in office, those same advocates are asking their legislators to be responsive, to follow through, and to support early childhood. This takes time, but it's a worthwhile investment to build up those champions for early childhood. And I'll share just one specific example, and maybe if we have time later, another. In Colorado, where I live and have worked with SCAN for about the past 7 years, we had a really strong grassroots involvement in securing a universal preschool program in our state. Funding for that was secured in 2020. So initially, we saw advocates testifying to their legislators, sending emails to their lawmakers, and asking those legislators to refer a measure to the ballot, a legislatively referred ballot measure, asking voters to vote on funding for universal preschool. That measure, Proposition EE, indeed went to a vote, and those same advocates who were meeting with their lawmakers turned to get out the vote efforts. We saw advocates writing postcards to voters, texting voters, doing literature drops, and they helped to turn out incredibly high levels of support for universal preschool funding across urban communities and rural communities and blue and red counties. So across party lines, voters turning out to support universal preschool. That kind of grassroots involvement is really powerful. And yes, lawmaker champions were critical to advancing the program, but community members and grassroots advocates were as well. And they have a stake in this program now. So in fact, just last year, a new ballot measure was needed in our state to really shore up funding for the program. And we saw many of the same advocates who had worked on this measure in 2020 turn back out, jump right back in, and turn out the vote to secure the additional funding that the program needed to access. We saw SCAN advocates alone reaching tens of thousands of voters with a yes on preschool message. So as a result, we now have a universal preschool program in our state that's serving more than 30,000 4-year-olds in rural and urban areas. And the grassroots organizing behind that was just powerful. And I think it's a key to advancing really meaningful quality early childhood programs and public investment in early childhood that advocates, community members have a stake in, feel ownership over, and are willing to support and defend when the time comes to do so when it comes to public investment and support.
Awesome.
And Annalise, this is how small the world is. Monica Wells was hired by Lisa Roy, who used to be the Director of Program Development at the Buffett Early Childhood Institute, and is now the Executive Director for Early Care and Education in Colorado.
Wonderful.
Love Lisa. Love Lisa.
Yes. So she got a shout out. There we go. And at a national level, we hear a lot about public and private partnerships in local communities as an alternative pathway to supporting both families and businesses, and as one of the innovative solutions for the need for access, affordability, and high quality childcare. Can you tell us about Lincoln Little's work in this area?
Sure. We have had some great successes in this area in the last 4 years, partnering with the city, the county, the state, the public school system to meet the needs of children and families and childcare providers. Early on and during the pandemic, our city allocated $600,000 of ARPA funds to Lincoln Littles to meet the needs of more families experiencing hardship paying for childcare. We have an ongoing tuition assistance program aimed at families in the gap. So we already had that established within our office. And so therefore we were able to process that funding and reach more families who were struggling during that time, where people were out of work and things like that. And so we had the infrastructure to be able to utilize that funding and get it right back out to the community. In addition, we've received Keno funding as well toward our tuition assistance program through the city. Also, our American Job Center partnership that I mentioned earlier in the workforce section is part of the mayor's internship program. And so that's that's new as of April. And so we're excited about the mayor's commitment to early childhood there. Additionally, we partnered with the county to improve quality among childcare providers. And we've prioritized those who serve large numbers of children on subsidy in diverse neighborhoods. So we know funding is necessary, among other things, to improve quality, but it's really difficult to improve quality if you don't have resources. And so we use those county dollars to start a child care improvement grant program. And 8 child care programs were awarded funding and were able to make improvements, such as painting, carpet, new refrigerators, materials, curriculum. I mean, there's such a wide variety. And we also partnered with Lakeshore to help some of these centers get new materials through Lakeshore for their program. So that was also a great partnership. But because of the success of that particular pilot that we did, it was called the Child Care Improvement Grant. Lincoln Littles now has prioritized with our yearly fundraising to designate a certain amount of funding to go specifically to what we call quality enhancement grants as part of our core work. And then also the county and the city distribute funding for human services through the Joint Budget Committee. And a big win last year was the inclusion of early childhood as a permanent funding priority within that Joint Budget Committee. So that was a huge win that has more sustainable legs than some of these other things. From a state perspective, we used Department of Labor dollars through the state to, as I mentioned earlier, to pilot that workforce program. And then lastly, partnered with our public school system to launch an emergency response system for childcare. So schools have standard response protocols should something terrible happen. But childcare communities do not. And so we had an officer who was shot near a school in our community. And the school, it was near a school and a childcare. And the school went on lockdown because they had these procedures in place. But just down the street, the childcare center was unaware and their children were on the playground. And of course, I just think about these are our community's children. And so Lincoln Littles responded to concerns from childcare providers after that incident. And these were ongoing. That just was sort of the event that caused things to go into motion, as well as Lincoln Littles being here to help support. And so we partnered not only with the public school system, but also with the police department, the health department, to establish a protocol specifically for childcare. And so childcare staff have now been trained and they're more prepared should the unthinkable happen. We've had other communities reach out to us and say, that they've also had an incident and they've heard what we're doing and they want to replicate. So we're fortunate to have forged these partnerships and much has been accomplished. However, we do know, of course, the need for sustained funding is really paramount as far as being able to make true change in the early care and education industry.
I agree 100%. Thank you so much. And as someone who has lived through what you just described with both fires and shootings, I'm grateful that you are doing something of this nature because it's not an area that we think about. We're thinking about the elementary school, but how many family childcare homes and childcare centers are in that vicinity as well that are just at as much risk? So thank you. So Monica, we're gonna ask our last question before we open up the Q&A. And just a reminder, please go ahead and include some questions in the Q&A. Monica, prior to working at Buffett, you were part of the formation of the Nelson Mandela Elementary School in North Omaha. North Omaha and South Omaha both have rich grassroots, very strong communities. For those that are listening to this call, not in Nebraska. And the elementary school expanded and then opened up the Nelson Mandela Child Development Center. You also worked for another initiative called Avenue Scholars with Lisa Roy. Can you tell us more about these experiences and just really highlighting how these are community lifting themselves up types of experiences?
Sure. Nelson Mandela Elementary is always going to be a school that's near and dear to my heart. I was there for about 5 years and supported them in the area of counseling and some leadership, and was there when they developed the early childhood program there. It's probably about 98% African American students there. It's what we call public private. It is funded by a philanthropist, and it's an amazing school. When you walk in the building, you can't really tell sometimes who's a parent or who's working there. The parents are built into the fabric of the school, and they partner with a lot of community leaders and support to gain resources. It's just an amazing school. You have to look it up. Genevieve Ford is the principal there, and they are doing wonderful things there at Nelson Mandela Elementary. And it's a school that you have to enroll in kindergarten, and you go in, you start in kindergarten, and then you go through fifth grade. And then they are supporting 3 and 4 year olds over at the Early Child Development Center. But their director is Miss Nicole Looper, who is doing a fabulous job. Just happens to be my high school best friend. She's doing an amazing job in early childhood. But the things that they are doing at those two schools, working with a lot of grassroots organizations and building things not for the community but with the community is something that clearly it needs to be studied. Actually it does. So I know that there's going to be links provided for those schools as well, but I would look at some of the wonderful things that are being done in those areas. And then Avenue Scholars is a wonderful, wonderful place. Ken Bird was one of the ones who started that through the learning community now. They are a partner with us in the work here as we are moving through those 4 areas of attendance, family engagement, literacy, and early childhood. It's nice to work alongside those who are focusing on the high school students and beyond. So at Avenue Scholars, they work starting with sophomores, getting them those life skills, helping support them, some coaching, helping with family engagement and family support. Once they graduate, we get them into a 2 year, 4 year education, or they put them into the workforce, which is awesome. Supporting them through that and then beyond. And so wonderful program there. They're doing some great things there. Lindsay Decker is now leading that work. So shout out to Avenue Scholars. But was able to be there to help watch these students and their families grow and learn as they navigate through life, navigate through childcare crisis within them. Some of our kids themselves we had to find and help them with childcare and navigate the systems with that, the good, bad, and the not so great. So we're all connected in this work, and I'm blessed to be able to work for those wonderful organizations and to continue to work with a lot of our leaders in the community who are leading this work.
One of the things that really touched me in my time in Nebraska was being able to visit Nelson Mandela Child Development Center and being able to see the power of the community and just it's a memory I will carry with me for life. So thank you.
Mhm.
And Avenue Scholars, one of the programs that Avenue Scholars did was they actually placed some of those high school students into apprenticeships in child development centers,
Yes.
which was one of the first forms of apprenticeships that we had in Nebraska. So thank you very much. So I'm first, before we jump into the Q&A, I wanted to ask our panel if they have questions for each other.
I think I kind of asked mine, Annalise. Will be number 8. The work that you all are doing is just amazing, and I just love to meet other champions in this work that we're doing. And you and I definitely need to get together.
Absolutely.
yeah,
We'll
our
make
work
sure, yeah, we'll make sure you guys all get connected afterwards. I know who to bring together. So our first question for all three of you is from the Mary Jo Grieve with Public Broadcasting, which has a very strong early childhood component to it. And the question was, in your community work, have any of the three of you utilized the services of PBS? I know Nebraska does have a fairly strong connection with PBS in that the early learning communities in Nebraska are connected, but have any of the three of you worked with PBS?
I know that we have had, we have a little bit, and we also have invited local PBS station to, we have a provider call that we do. It started during the pandemic just to keep providers aware of what was happening, you know, on a weekly basis as things were changing so quickly. We've now backed off to once a month, but we still have such great participation each month, and we bring just, you know, it might be licensing or regulations, or it might be the health department, but it also might be something that's just a one-off to get information out. And so I know that we had our PBS station on to talk about different programming and different possible partnerships, as well as we connected our early childhood network with them as well. So I can't speak specifically about what we've done, but I know that we've had, you know, exchanged emails and invited on to different calls that we've done.
I know I think I was at one of those meetings with you. And I know that I've worked with, I think it was an early learning community meeting where PBS was also there in Nebraska. And Elise, how about Save the Children?
Not that I'm aware of. Not that I can recall, but I'm sure love hearing about these initiatives and ways in which people are coordinating with PBS.
Monica, do you have anything to add on that question?
I would say I would agree with both of the ladies, not personally myself, but I know in our workforce, Holly, wink, wink, that we have touched them, and then within our learning communities as well. So we have some amazing people who have worked in workforce here and have had a touch, but not myself personally.
Yeah, I don't know who that person is.
Mhm. She might be close.
Our next question comes to us from the Leon Levine Foundation. Agreeing with the premise that economics of early care and education aren't working. High quality care is expensive. We know that. Educators aren't able to get high quality benefits. Public subsidies don't currently cover. And we're about to, we are already experiencing, but it is about to get stronger, the fiscal cliff, because ARPA dollars have to be spent before the beginning of the federal fiscal year of 10-1. What extent, how would you see, you've all talked about local innovations, but I'm going to use this question to kind of draw out a little further. One of my favorite questions to ask people, I'm going to give each of you a magic wand. You can load it with anything. As much money as you need, as many resources as you need. What are you going to use your magic wand to do to help bolster or strengthen one area in your work? And we will start with Annalise.
Holly, I want a little more time to think about that one. But I think just expanding the work we're doing. So Monica, to your point, you know, if we could be in every community in every state doing grassroots organizing, that would be fabulous. You know, working closely with our family engagement program, I think every way in which we can connect with caregivers, family members, to really bring their expertise to grassroots advocacy and to policy design. I would love to see more of that. I think we're going to get, you know, the best programs, the most sustainable programs that really solve for the problems that we as families are facing when we bring in the expertise of those caregivers. So I'd love to see more of that. Love to see it happening in more places. And with time, hopefully we will see that.
All right, Anne, you're
Well,
bippity boppity boo. You've got the
I
wand.
know. I was really, because I was looking at this question, I was thinking more about, I know the question, more specifically was, to what extent does it make sense to bolster the supply of childcare employees without first addressing the factors that make this a broken market? So, I mean, there's so many things, but I was really honing in on that question because I've been conflicted in my own mind about our workforce program, because I mean, it's hard to, incentivize people or into something that, really they're not in Lincoln. I know we've done a survey. Um, the average hourly rate is like $11.08, and we know that a living wage is $16.78, and they're not
And going
getting
up.
benefits. I mean, like, that's conflicting in my mind,
Yes.
but I'm also responding to working with childcare providers who, can't make ends meet because they can't enroll enough kids because they don't have the staff. And so, while I struggle with that in my mind of what actually needs to happen, but what do I have the power to change right this minute? And so we're working so closely on the ground, just being a small sort of startup and hearing what's happening in the field, that we're reacting to that, knowing that whatever we're doing, we hope will be good research for policy change higher up. So I think, and we've seen in the Nebraska legislature, there was a bill this last year about, paying for childcare. If you work in early care and education, you will automatically qualify for subsidy. So I know that's happening in, I think Kentucky maybe is one of the places that's happening. So that did not pass with any funding, along with it, but we know in our small little microcosm that it was working.
Yeah.
And so, so I mean, that's not really answering your magic wand question, but I think it's because I really wanted to get at sort of the issue.
Actually, it is. It's what you're answering it. It is the Hunt Institute does state legislative retreats, and we did one in North Dakota. And over and over and over again, the statement was made, until we fix the educator problem, we can't really address any of the other problems.
Yeah.
And so that is telling me that the first thing you would do with a wand is make it a thriving wage.
Yeah.
And create
with benefits so that people.
Oh yeah, thriving. Absolutely. That definitely is
Because
it.
we also know that we've had a lot of people who are passionate about taking care of, educating children and taking care of children that have left because they have no other choice, because they can't take care of their own family.
Right. And
And
that is there are more of us doing this work that are doing it not, it shouldn't. We could do 3 webinars on this topic. So we're going to move forward and try to stay in the positive. But I do want to say, both Anne, Annalise, and Monica, everything that you're doing is the reason that we're doing webinars like this. Because the more knowledge we can gain, the faster we can move that needle. So thank you. Monica, I think I've given you this magic wand before.
No, give me that magic wand.
What are you going to do with yours?
Oh my goodness. I would agree with both ladies, but definitely for our early care providers, we need to pay them.
Yes.
Pay them.
Yes, absolutely.
Also make sure that we're providing benefits. The work that they do is hard work, and they want to do it.
Yes.
And they know their why, and they're strong in it, and they're developing our babies. And the workforce can't happen if they're not taken care of. Then my magic wand would pay our teachers. Pay them, pay them, pay them.
Exactly.
But, and pay them what they're worth. A lot of, if money wasn't an option, I would focus a lot of it on mental health. I don't think we talk about that enough. We talk about it and more now since COVID, but I still don't think we talk about that enough for our providers, for our children, for our parents, for our teachers. We need to provide resources and pour money into that. Um, and then definitely just continuing to build up our families with resources. My magic wand could expand, but I'll stay on topic and say that's probably what I would focus on and expand the work that we are doing here at Buffett Early Childhood nationally. That's what I would do.
So we have a question for Annalise from Madison. Did universal pre-kindergarten affect childcare providers, or did Colorado make plans for a mixed delivery system that helps support childcare centers?
That's a great question. Yeah, I think we know that preschool doesn't exist in a vacuum. It's part of a greater ecosystem of care, infant through moving on to kindergarten. So Colorado's universal preschool program really did focus on mixed delivery. I think around 2,000 licensed providers signed up to provide the universal preschool program, and that included school districts, community-based providers, and home-based providers and private providers. So there was a real emphasis on mixed delivery, and that was important to the folks designing the program and to the voices of advocates that were advancing and promoting this program, was to ensure that there was a mixed delivery model. So very much part of the program.
Great. And for Anne, Julie Garber asked about sustainability of workforce grants. And can you talk a little bit about the amount of fundraising that you do? Because I'm always amazed at all of the innovative ways that Lincoln Little is doing fundraising.
Well, I'll say that no, it isn't sustainable, the workforce stipends. And so just to be very frank, we, again, are small. We haven't been around that long. We're constantly looking for opportunities to deal with what is happening before our eyes. So we know with what we just talked about that we have to pay people more. We have to, if they're going to be in this realm of childcare. And so again, that goes with that conflicting in my mind I talked about before. Like, how do you encourage people to work in this field when you know they're not going to make a living wage? And so that's where we thought, okay, we've got this department where part of the goal of that funding was to get people back to work. And then we were trying to be creative with what we already do, which is tuition assistance. And what I will say, we knew that wasn't going to necessarily be sustainable, but again, it's a test case for what that looks like in a small pilot study. And now we are also using some of the fundraising that we do on a yearly basis, and we're earmarking a certain amount of that funding for people who work in childcare. So we already are looking at people in the gap, but we also really want to say, we did this workforce program. We offered childcare tuition assistance for those who were working in childcare through that grant. But we think it's so important that we know that we can't, we don't necessarily have more Department of Labor funding, but we as an organization are going to earmark for people, to incentivize people to work in childcare, or to help people who are already working in childcare who are realizing that they really can't make ends meet. And so again, it's just another pilot to help policymakers look at what's happening, on a very small scale, and then maybe on a bigger scale, if we get that passed through our own legislature to pay for childcare. Yeah, as far as fundraising goes through our community, we just have had great response philanthropically through our community, through Lincoln. I mean, just lots and lots of public support for early care and education, which has just been fabulous. And lots of growth over the last 4.5 years in that fundraising as well. But we know that philanthropy can't do it all. And that's, where we're finding funding through partnerships with county and city and state. And so we'll just keep keeping on while we try to attend to immediate issues that we see here locally.
And the last question I have here is talking about working with businesses. And if the three of you could just address how working with businesses, whether they be local in rural areas, corporations, how does that look for in all three of your roles?
I can start and just say that we do have a business plan in Lincoln Littles where we've worked with about 20 different businesses locally here in Lincoln, and we've partnered with our Public Policy Center to come up with a survey to work specifically with businesses to find out how many people do they have on staff who have children under 5? What kinds of challenges are they seeing on a day-to-day basis related to childcare? And so we do an initial meeting with those businesses, talk about the survey, do a little tweaking here and there based on, specific needs that business might have. And then we provide them with the link to administer that survey to their staff. Often they like it because in partnership with we do use that data here in Lincoln. So if they're feeling a little bit reticent about administering a survey, because sometimes when you administer a survey, you for sure have to do something with the data. So they do it in partnership with us and along with the Nebraska Public Policy Center. We've also partnered with First 5 Nebraska here in Lincoln, or here in Nebraska, and their policy organization to do this work. And then we analyze that data and then help those businesses figure out how they want to address what they've learned through the survey. And it could be something as simple as, wow, I didn't realize we had so many people with children under 5 that they're trying to get to childcare. Let's not have a 8:30 meeting. Let's have a 9:30 meeting. Or it might be all the way to it could be, we've got Huddle here in Lincoln who partnered with Primrose to offer childcare for Huddle employees. I mean, that's, so you go from no cost, low cost, all the way to maybe, a childcare center within a business, and then lots of opportunities in between. We currently are working with a business that's interested in our tuition assistance program and wanting to examine what that looks like and see if they could do something similar within their business.
Thank you so much. Annalise or Monica, anything to add?
Yeah, I would say that we can't, this work we can't do alone. We're always partnering with a lot of our businesses around within the superintendent's plan, always looking out the backyard to make sure that the businesses and the schools are connected and aligned, just like our child care is to provide resource and support. And again, build the school up with the community and not for the community. But I'd go back to the We Care for Kids campaign. We have over 100 plus organizations that are help sharing and spreading awareness of the crisis in childcare, because that's how we get to the legislation. That's how we get things passed. That's how we bring this awareness to rural areas. We are highlighting and uplifting the stories of childcare providers all throughout Nebraska and hopefully beyond. So thinking about your question, I really thought about the We Care for Kids campaign. And if anybody's on this call, you should
Excellent
check it out.
example.
Yeah, a very, very good example. And if you're interested in partnering with us, we would love that.
Yeah, and we will be putting all of that into our key takeaways document. Annalise, do you want to wrap us up with any last final comments on that question?
Yeah, I think going back to thinking about what works in grassroots organizing, and it's that point that Anne brought up of shared interest or interested parties and creating and, joining coalitions that have really diverse voices. I think the business community is a piece of that and can speak to how critical early childhood opportunities and childcare are to sustaining the workforce and to sustaining our economy. So an important voice, important to work with in those coalitions. I think we know that so many children have, multiple caretakers in the workforce, and businesses can, really bring some ideas and speak, as Monica pointed to the decision makers, to policymakers, about how vital public investment in childcare is to our economies locally and at the state level and nationally.
Thank you. Well, we are at time, but I would be remiss in not extending a humongous thank you to the three of you. It is an honor to have you on this call. And Anne and Monica, I miss you very much. And Annalise, I will see you in August. Our next webinar will be on Monday, August 19th, and we are actually very excited. We're going to be doing a joint webinar with our educator diversity department on Black early childhood education, which is an organization in California for Black early childhood educators, and for to raise up the issues there. And in addition to that, we will be represented from a first grade teacher from the state of Georgia and hear about her work with Schoolhouse Wrap. And that's going to be on August 19th at 1 p.m. Eastern Standard Time. Everyone have an amazing evening, and thank you so very much, ladies. Take care.
Thank you.
Thank you.
Much.